There are several different ways that we can successfully treat obstructive sleep apnea, and they range from very, very simple to much more complex. Let me explain. For some people with just minor cases of sleep apnea, all they need to do is sleep on their side instead of on their back. Sometimes just rolling over onto your side takes gravity away from helping your tongue fall back into the back part of your throat, closing off your airway and causing you to not get enough oxygen. Sometimes losing weight can help because as we get thinner, our necks get thinner. Our tongues, which are very marbly muscle, can get thinner. So sometimes weight loss and position of the way you sleep will be treatments. And so losing weight, certainly a good treatment. Sleeping with 3 tennis balls sewn in the back of your shirt, or a fanny pack with some crumbly material in it so that it's uncomfortable to lay on your back can help position somebody differently while they sleep. And then there are things like oral appliances. And oral appliances are these lovely little upper and lower mouth guards that fit together and hold your lower jaw forward and open the airway in the back. Probably most of you have also heard of CPAP or BiPAP or APAP. The PAP stands for positive airway pressure. That's a hose and a mask. Sometimes the mask just fits on the nose, sometimes over the mouth and the nose. The hose goes to a machine that lays along your bedside and puts just a little gentle positive pressure of air, positive airway pressure, to help keep your airway open. They work great, kind of hard to wear, and most people don't like the hose or the noise, and sometimes they'll wear them the first part of the night and take them off the second. There's also surgical procedures. In the back of the throat, the little thing hanging down, the uvula, and the back of the throat can be kind of constricted. And so opening that area up surgically, which is what's called a UPPP or UPPP procedure, opens that airway up. That doesn't work very well in adults, about 10 to 12% of the time. But in children, taking the tonsils out or opening the airway up in the back can be a very effective surgical treatment. Other surgeries that work very well are Inspire therapy, where you get a cardiac pacemaker looking like box on your chest, under your skin, and some wires that go up to your muscles that help keep a little bit of muscle tone in your tongue muscles while you're sleeping, keeping the tongue forward, keeping the airway open. And finally, breaking the upper and lower jaws and bringing them both forward in what's called a maxillary and mandibular advancement works almost 95% of the time. So a wide range of treatments from don't sleep on your back to some pretty involved surgical procedures, and which one is right for a person can vary greatly. We always like to try all of the least invasive things first.